311 443 or 0926 882 493 or visit iRadio offices in Jebel Korok, Juba.
This is iRadio. When contributing to a topic on the radio, please avoid statements that may incite or promote hate. We encourage constructive points of views and criticisms that aim at providing solutions to problems facing the country. We do not want rumor mongering or information that is regarded as hearsays. We advocate for messages of peace and unity among the people of South Sudan. This is iRadio, your eye on South Sudan.
iRadio, for reliable and objective news from across South Sudan and beyond. Tune in to iRadio, your eye on South Sudan. iRadio, for news you can rely on from across South Sudan and beyond.
The Dawn on iRadio.
Yes, a very good morning to you and welcome to the second half of the Dawn program here on iRadio, a live broadcast from the capital, Juba. I'm your host, Emmanuel Joseph Akile, and today is Thursday, the 22nd of May 2025, coming to 16 minutes now after the hour of 7. Now, in the second half of the Dawn, we are going to look into maternal and child health with focus on exclusive breastfeeding, poor child spacing and hygiene in delivery. Well, maternal and child health in South Sudan faces significant challenges due to conflict, weak healthcare infrastructure, and limited access to essential services. South Sudan has one of the highest maternal mortality rates globally, with 1,150 maternal deaths per 100,000 live births. So to shed more light on this topic and to have a broader discussion, I'm joined live in the studio by two guests, Jokudu Joyce Poni, who is a registered nurse, and also Chaplain Mila Cosmas, registered midwife. It's good to have both of you in the studio this morning. Welcome to iRadio.
Thank you.
Yes. Poni, let me start with you. Tell us why is maternal and child health is very crucial actually to the well-being of families and communities at large.
Well, maternal child health is crucial in the family and the community as whole because maternal health is fundamental for health family. Therefore, when the mother is healthy and the children are also to be healthy. In the other way, maternal health is important because it reduces maternal and mortality rate in the country. That is also if MCH is well established, it reduces all those crucial things to the family and the community as well. Also, the other point is it breaks through the cycle of poverty, whereby if the family itself is poor, or the family is always, all the time, is falling sick, and then it affects the financial issue of the family, and it will not manage to take the children for treatment. Well, it also promote economic and social development to the community. That's reduce complication to the burden healthcare system in all our nation, all nations.
Right.
Yeah.
Yes, and Cosmos, let me come to you and we talk about exclusive breastfeeding. what are the key benefits of exclusive breastfeeding for both, actually, the baby and also the mother?
Okay, I want to appreciate the management of iRadio for hosting us today, and our host of today's topic, Mr. Kila Emmanuel. Actually, we are here today to discuss on the topic, as it was stated. It's under a maternal child health, and when we talk of maternal child health, it is the health that a woman, it's the health of a woman during pregnancy, childbirth, and after the postpartum period. Postpartum period is, let me say it, after the birth of the child. This mother is actually supposed to get some health tips that may help the mother. Exclusive breastfeeding. This is a moment of giving, breastfeeding a child, actually, from birth up to 6 months, without giving any other complementary foods like water, and unless except of oral rehydration salt or syrups, because but these are indicated maybe when the child is not well, actually. When we talk of the benefit of this breastfeeding to the mother, and sometimes also maybe to the child, let me start with the child. You know, this breast milk, they contain antibodies. It helps the child to build a strong immune system of the body. Secondly, it bond relationship between the mother and the child. Actually, because when you are being together, the baby may be feeling fine, and even sometimes the mother also being fine. Sometimes it helps also prevent the baby from other diseases, because you know, breast milk, it contains a lot of nutrients. It may also help the baby through that process.
Right, and Pony, still on the issue of exclusive breastfeeding, I want you to talk to us a little bit about common misconceptions about exclusive breastfeeding, and also how can they really be addressed today?
Manuel Ohile, concerning the common misconception about exclusive breastfeeding in our community or in our people, once the mother deliver a baby, the community or the family will end up saying that the baby need water because the milk is not enough, so they need like to add water to give to the baby. And yet this is not a recommended medical mandate, whereby in medical, if baby is born, we are, as a health personnel, we are to encourage the mothers to breastfeed this baby up to 6 months. That's when we shall include other solid food or water to the baby. Another common conception is also breast milk alone is not enough. It needs to be given what? Solid food. And yet this baby is not yet reached to a level of introducing some other food. And this is our role as a medical personnel or a nurse or a midwife to encourage the mother to not introduce any food to the baby unless the baby reaches 6 months. And in the other way, also, the mother with small breast, in our conception, our people outside there, they're believing that if your breast is small, you're producing limited milk. But that's not the way. The more you breastfeed the baby on demand, then that's when more supply of breast milk is coming to the baby. So we encourage the mothers not even to have all those conception because it's not recommended. Yeah.
Right. And Cosmos, how does then exclusive breastfeeding impact the long-term health of a child, if we talk about it?
Thank you once more. When we talk of the breastfeeding, actually the impact may be, it may have enable the child to build a strong immunity. Because when we know breastfeeding milk allows from the mother, they contains a lot of nutrients. The content of nutrients may help the child to develop a strong immunity. Secondly, the child will even grow with will have a positive and emotional strength. The child actually may not have a stress because since she's just close to the mother, she's having this milk anytime she wanted to eat. Then the other one is also it helps to reduce an access of chronic diseases. Yeah, chronic diseases actually, when sometimes if you have a strong immunity, it may get registered to other diseases that actually have and need an access to overcome you. But if you have a strong immunity, you may able to get this all, and they may not easily get access to you.
Right. Bring us about 26 minutes after the hour of 7. We go for this break and we will be right back. Good morning.
of Health is conducting a commemoration of African Vaccination Week with rotavirus vaccine targeting all children aged between 6 to 10 weeks. Take your child to the nearest health center during the African Vaccination Week or the Big Catch Up campaign.
Good morning, Mama Nyandeng.
Good morning, Mama Mercy. Where are you coming from this morning?
I had taken Mercy for rota vaccine at the health center to protect my child against rotavirus diarrhea in infants and children. She was also vaccinated with other routine immunization vaccines at no cost. Is baby Mercy already vaccinated?
Yes, she was vaccinated last month. Does she need to be vaccinated again?
Yes. She needs to be vaccinated with at least 2 doses of rota vaccine at 6 and 10 weeks to be fully vaccinated, immunized, and protected against rotavirus.
Really? I just heard from afar that there will be a vaccination campaign during the African Vaccination Week, but I was not keen enough to get the details.
You know, rotavirus vaccines are effective in preventing diarrhea and deaths in infants and young children. This vaccine has just been introduced this year, 2025. A lot of children were not vaccinated. Some even travel without being vaccinated. I wouldn't want to see any child get diarrhea.
I didn't know that rotavirus is that serious, that it can even cause death.
Yes. Rotavirus is a life-threatening disease caused by the virus. The signs are fever and vomiting, followed by watery diarrhea, and can cause abdominal pain and dehydration. Children who survive may be dehydrated, which can cause serious complications.
Dehydrated or serious complication? Oh, that sounds scary. How can I protect my child from this dangerous disease?
The only way for your child to be safe is when your child and all children in your neighborhood are vaccinated with rota vaccine.
I will do that immediately. Where can I take my child for these vaccines? Hope it's not late.
No, you are not late. Rota vaccine and all the other routine vaccines are available at all health facilities and designated health centers located in your areas. Tell all your neighbors with children between 6 to 10 weeks to be vaccinated.
I'm glad you told me. I will take my child immediately to the nearest health center for rota vaccination.
Bring your child to the nearest vaccination site and protect them from rotavirus and vaccine-preventable diseases. This message is brought to you by the National Ministry of Health with support from WHO and UNICEF.
Ready to give your engine the best care it deserves? Introducing Tropics Fully Synthetic Petrol Engine Oil. Engineered for peak performance, it provides superior protection against wear and tear. ensuring your engine runs smoother and lasts longer. For diesel engine drivers, meet Atro Oil Platinum Engine Oil. This premium oil is designed to enhance fuel efficiency and reduce emissions, giving your engine the power it needs to tackle any challenges on the road. 2 Oil, 1 promise of hassle-free reliability. Visit your nearest Haas petrol station today and experience the power of Tropics and Atro Oil, because what goes to your engine matters. Haas Petroleum is servicing new frontiers.
وزارة الصحة قاموا ذكرى تتتيم أسبوع الأفريقي بتتيم تحسبة الجديد لإيال كله من عمر 6 ل 18 شهور. شيلوا جنتك في أقرب مركز تتتيم في فترة حملة الكبير ده.
صباح الخير أمة ميري.
صباح النور أمة غلوريا. وإنت راجع من وين صبا زيدي؟
أنا شيلو غلوريا عشان بوريلو تطعيم تحسبة في مركز الصحي، وكمان وديلو تطعيمات تانيين الروتين لمناعة، ودي كله مجان. سيتا شيلو ميري كلاس لتطعيم؟
أي أنا شيلو في تطعيم شهر الفاد، ولا كمان دير كدنا رجعو تاني.
أي أو محتاج عشان بتعمو تاني، على الأقل كدو شيلو 2 جرعة تطعيم تحسبة، وباقي تطعيمات تانيين الروتين من 9 ل 18 شهر عشان حسبة ما بيجالو.
سي أنا اسمع من بيت قالي في حملة تطعيم بيجا عملوا في فترة تاع أسبوع الأفريقي للتطعيم، لكن أنا ما كنت بالتالي لتفاصيل تكلام دي.
إنت عارف تطعيم تحسبة دي وكمان فعال وبيشتغل قوام وبيحامي جنا من حسبة وموتوا لإيال البردة وإيال السكرين. إيال كتير ما ودلو من جرعة نمرة 2، وفي تانين ذاته سافر بدون ما بيشيلوا تطعيم دي. أنا ما دير أينو إيه جنا بيقو بدو بحسبة.
يا سلام، أنا ما أعرف قالي حسبة دي مرض الخطر زي دي بيسببوا ضعفات وكمان بيجيبوا موتوا لجنة تاعي.
أي مرض تحسبة دي وبيهددوا حياة وسبب تويا فيروس تحسبة. علاماته حمى وقحة، أنافة بجري موية، ويون بتالا أمر وبجري موية، ويالا اللي بيكون كويسين من عيان دي مناعتهم بيكون ضعيف ومم بيكون عنده مشاكل في مخ، لكن ده نادر ما بيحصل كتير لكنه خطر كمان.
جهاز المناعة بيكون ضعيف وكمان بيسبب مشكلة في المخ. مالو كلام ده خاوف أنا زي دي. أنا سيب بقدر حمي جنتي كيف من مرض الخطر دي.
طريقة الوحيد عشان جنتك بيكون في أمان ده كان جنتك ويال تحلة شيلوا تطعيم تحسبة.
أنا قرام الكلام ده حاسة دي أنا بلقوا محل تطعيم ده وين، وأنا بتمنى إن شاء الله أنا ماكر.
لا إنت ماخر. تطعيم تحسبة دي وتطعيمات تانين الروتين دي كله متوفر في مركز الصحي ومحلات الخصصوا لمركز الصحة في حلتكم. وريلو كل جرانتك الإيال تمن من 6 ل 59 شهر عشان بيشيلوا إيال تمن في تطعيم.
أنا مرتاح عشان أنت وريلي أنا خبر ده. أنا بشيل جنتي حاسي لأقرب مركز الصحي للتطعيم عشانو بيلقوا تطعيم تحسبة دي.
جيبوا جنتك في أقرب مركز الصحة عشان يتبهاميو بتطعيم من حسبة وأيانات تانين، وبعد تطعيم بوديلة كريت وكده تحافظوا تمام، كده تستمر دو جنا أليندو حسبة دي وكده توديلو أكل الفوق غذاء تمام. الرسالة دي جالتكم من وزارة الصحة بمساعدة من WHO ويونيسيف.
South Sudan, iRadio, South Sudan, iRadio.
Yes, very good morning to you once again and welcome back from the break. هنا لسه بنتكلم في موضوع بتاع صحة الأم والطفل، وبنركز على الرضاعة الطبيعية الحصرية وضعف المباعدة بين الولادات وكمان النظافة في الزمن بتاع الولادة. وطبعا ساهمت الأم والطفل في جنوب السودان بيواجهوا تحديات كبير ده بسبب النزاع وضعف البنية التحتية للرعاية الصحية ومحدودية كمان بتاع الوصول للخدمات الأساسية. لسه عندي معي 2 ضيوف في الاستوديو. Now let me come to you Joyce, and let's talk about poor child spacing, and tell us some of the risks associated with poor child spacing for both the mother and the child. So if the child spacing is poor, what can be some of the risks؟ يعني بعض من المخاطر والخطورة في كلام المبادرة.
Well, thank you again for having nice break, because we cannot spend the time all the time communicating, and thank you for giving us the break time. So back for the communication about poor child spacing, about the risk factors. One of the risk factor about poor child spacing is poor nutrition sufficiency. Like if the mother is not getting enough nutrition for her well-being, the mother will end up entering to other complications. Like the mother is lacking ions and calcium, and it will end up going to a certain kind of nutrition which is not good for the well-being of the mother. And then coming again for the second bullet for concerning the risk factor about poor child spacing, poor child spacing increase risk of complication of the mother, because if the mother is consecutively conceiving and the utera is not getting that, going back to its normal place, the mother will end up getting risk factor, of which it will end up having a uterine rupture, which is not good. So we are encouraging them to have that length time of production, maximum 2 years to 3 years, and then she's allowed to conceive another baby. Another risk factor is also maternal, mental and emotional stress. You know, the mother is not getting time, and then she's always there conceiving. Herself even will end up getting stress, which is called postpartum depression, because all the time she's stressed, having baby, this one is crying, and then the other one is in the womb, no time really. So we are really encouraging them to have that maximum time, or let them follow the method of child spacing by visiting the facilities whereby they can get access of family planning and get that child spacing well. Or else by introducing, or we are involving the men also to attend reproductive health services, so that those education will encourage them to have a decision making for a maximum spacing of the children in the family.
And you're saying from 2 to 3 years at least?
Yes.
All right.
Yeah.
Yes. Cosmos, now, how does poor child spacing affect maternal health and recovery after childbirth? And also, maybe a little bit you can touch on what cultural or societal factors contribute to poor child spacing and how they can be addressed. Yes.
I want to say welcome back from the commercial break. We are still a continuation from the topic of our discussion today. When we talk of poor child spacing, actually this is having a short interval between pregnancy, because you see there are some mothers, maybe the baby is still 1 year and they're still carrying another pregnancy. And actually these blips comes, we are talking on the cultural and the, actually this may happen, in some other cultures, because some men, they said maybe when they see there are some other large communities, and they said for us, why are we staying at this when we shall have to deliver more and more and more, and actually that one sometimes encourage men to have more children, and the mothers they deliver early when it has not reached to the time of where it is exactly supposed to have another pregnancy and they have another baby. And then the secondly is male involvement. Because I know there are some communities, if you have been staying with them, actually you may have that, if you're not wise enough, you may get involved in some other groups actually that may easily involve you to some other issues where you may let yourself even in a different position. Then the other thing, it may be preference. May be a preference to fertility, because there are other people they want to show that I'm a man, I'm supposed to produce. I'm not supposed to say like this, where it is my duties, I have to produce, even if how many times. Yeah, that is what I just add to, and that is the cultural beliefs.
Right. And now, Pony, let's a little bit talk about hygiene in delivery. So, what are the essential hygiene practices that should actually be followed during childbirth? The hygiene practices.
Well, thank you again for giving me the opportunity to talk about the hygiene in delivery. About the hygiene in delivery, hygiene actually mean that a clean and sanitary practice following during childbirth to prevent infection in both mother and newborn child. So the essential hygiene practice during childbirth or delivery, one of it is we make sure the delivery surfaces need to be clean, and then followed by hand washing. You need to practice a medical hand washing practice whereby you wash hands sterilely before touching the mother to avoid infection. Also, you make sure the mother, because they are attending natal education, when coming for delivery, you make sure the mother is also clean. The perineum, which is genitalian area, need to be clean to avoid infection entering to the uterus during delivery. Also, we need the delivery kits need to be sterile. Because if they are not sterile, we are introducing bacteria to the mother and entering to the uterus. Also, one of the hygiene we need to emphasize on the hot caring need to be clean also. All this, it will contribute to a safe mother delivery, including the baby.
Right. ده بيجيبنا ل 18 دقيقة لرأس الساعة. ده الوقت اللي فيه نرفع المكالمات. اتصل علينا على 1122 986 9886 أو رسل رسالة بتاعك على الفيسبوك. بنتكلم في موضوع بتاع صحة الأم والطفل مع التركيز على الرضاعة الطبيعية الحصرية وضعف المباعدة بين الولادات والنظافة أثناء بتاع الولادة. Radio. Yes. Engineer Moses, welcome.
Ana ndi ruwa loman kede. Maluman ma bukilim biara bitabana madki gari yu radio akin alkatir betul ma basma English. Why do you not teach the Arabic? Yes.
يلا سؤال بتاعك شنو تقدر تعرفه عشان هم بيجاوبوا؟
السؤال بتاعي اسمع النزوان البام ريال جاري يوز بالعربي ما بكلم بالكثير بالانجليزي معلومة ما بكلم بالعربي عشان نزوان ده جاري فهمه هل جنب بام تقول كيف أكاد تيجي بوديلو من مويو بوديلو أكيل أتو عشان ما نفهم.
alright شكرا لك. جنب بمسكو كيف موضوع بتاع الرضاعة أو البريسفيدنج بيكون كيف جنب بدو موية في أتو الزمن من ما يلدو وده بعد من أسئلة بتاعه بالعربي. ده إنجينير موسيس. ضيوفنا حيجاوبوا. نرفع مكالمة ده اي راديو.
Good morning.
Yes, good morning. David Magog from WA. Welcome.
Let me welcome your guest in the studio. And our explanation is okay. But I have questions, especially our sister in the studio. Those educated girls somebody like you. They say that breastfeeding can even make you old, that there is no need for a child to be breastfeed for a year or 6 months. Only the time she's delivered, then she will only tell you that go and bring Disnan one from the shop. Now, is it education that is telling you people like that, or are you copying the Western world culture so that you avoided the breastfeeding of the children? And now this one is making the law opinion to be people to marry the educated girls because they are very creative of different things which are not accepted. When are you going to make awareness so that you inform them to respect the scientific study of breastfeeding a child for 6 months? This is number one. Number two, do you have an awareness? You will, by using either the mother tongue or you show some pictures and so forth, do you make it in rural areas, especially the remote areas? Because in the town, we don't talk about it. They know what that is. Lastly, some women currently, they don't even want to conceive children at the right time. They only have one child and they spend something like 3 to 4 years and they bring another one. Is it education, or you, the women, you have a different ideology that you want to bring in South Sudan? Thank you.
All right, thank you. Thank you very much. Let's pick one more call. Radio.
Hello,
Yes.
Franco.
Welcome, Franco.
أنا أسأل طبعا المراكز الصحية بتبقى هنا كان زمان ضد الفلوس على الأطفال الصغار الربا بيكون بيتعامل من الشرطة. هسه عليهم بقى ما في هم عذاب بقى في هل في ولا ما في؟
سؤال ليش نو؟ كده قولوا تاني.
أنا قلت في المراكز الصحية بتبقى هنا طب وظفوا المواد تعتقد
وكان بيسأل في موضوع بتاع نوتريشن الأكل اللي بدو لعيال في PHCCs زمان كلام ده كان قودي لعيال أو لو ما حدش ندود هسه كلام ده فيه لسه ولا ما فيه؟ راديو. All right, let's come back to our guests in the studio to respond to the 3 or 4 questions from Engineer Moses, Moduta Arabi, David Magog, and then Franco Sibit. Who wants to come in here? Maybe let me start with you, Pony, because Magog was specifically directing his questions to you, the issue of breastfeeding. Some women, he says, some women don't want to get old. And he talked about the issue of breastfeeding, of actually ending it earlier than expected, because many of them do not want their breasts to fall, you know. That some women feel like they don't want the breast to fall, so that they don't want to breastfeed their children. What would you say about that? And he talked about the Western world, the issue of education. Sometimes educated women, they give birth to one child and they stay for 3-4 years to give birth to another. So I want you to comment on this in general. Yes, go ahead.
Thank you. Indeed, to answer his questions about women who don't want their breasts to fall, or concerning breastfeeding in general, we are not actually hoping the Western or the world's culture kind of scientific kind of thing. So we are just basing on researches that are done, and because child need to be breastfed based on World Health Organization guideline. That's why we are basing to use the guideline to prevent all those other things that are affecting the children. If the baby is not breastfed and it is introduced or some other food or water, it will end up going to other sicknesses like pneumonia, and then respiratory tract infection, gastrointestinal infection. It will end up going to those kind of things. But it's not a mandate that women are refusing to breastfeed their babies. That is not the goal. Because we are mothers, and when baby is delivered, you are there to breastfeed your child at any time, day and night. there's no obstruction that you don't want to breastfeed your baby. Exception for those who working class women, sometimes they will breastfeed their baby during the time when they are around. During the working time, they'll go for work. But mandatory rule is to give them this interval of being at home, like for 3 months. She's really born to care for the baby, and then the working place will call her back for the working area. And at that moment, for 3 months, you're there consecutively breastfeeding your baby. And at that time, that's when you will introduce maybe the bottle feeding, because of the condition you're going to work. But if you're not really working, we are not encouraging those bottle feeding to be introduced to the babies. More on that, maybe my colleague will add.
Yes, Cosmos.
It's okay, thank you. We heard of this question. Actually, my brother, it's right. I know in the community, I've even seen there are some other mothers, they say they don't want to breastfeed their children because their breast is going to fall. And actually, it is not the case. Sometimes, these things may be genetical. It may be a genetical issues that may raise. It's not because of the cause that breastfeeding can easily pull your breast down. And even say there are some beliefs that when the mother is sick, is not supposed to breastfeed the baby. And the milk itself, it contains antibodies, and these antibodies, it protecting the baby. There is nothing like that. Maybe the baby, it may get the sickness from the mother. But I know it is a concern. Really, these things are happening in the community, and we should say we really need to be strong, and we get some awareness on these issues, because this is happening actually in the community. So thank you so much.
Yes, and there was a question about nutrition in some of the healthcare facilities. Back in the days, people used to receive support, especially mothers, but what happened now?
Actually, it's right. And sometimes this may be a policy. It may be from the government or from the humanitarian aid that are actually supporting all this, because we know all this program is supported by humanitarian aid, the organization which is supporting all this initiative for the nutrition. And it's right. I've witnessed now, and I have not even seen that these services are still there in one of the PCCs, because this may be their policy. We don't know whether it is a donation issues. We don't know actually if it is something also related to the government, and I think it's our request. It's a request that we really see. If we are to see the rate of malnutrition, actually it is getting high. We really urge the humanitarian aid and the government that they bring all these services such that our children get this good nutrition, just that in order to reduce the cases of the mortality rate in the country. Thank you.
Right, we have a number of comments here on our Facebook, and I want you each to respond to let me pick two from Ustaz Abdullah. He said it's really pity. Imagine in some remote parts of the country, mothers and unborn babies don't have any access to health facility. That's one concern. Another message on our Facebook from Dolipi Christopher. He said, good morning to you, Akile, and once again, good to your guest, Jokudu Joyce Poni and Chaplain Mila Cosmos. We are happy to hear your voice. My question goes to your guest. What are the preventive maternal mortality rate in South Sudan? And what time should a woman get pregnant? He's watching us live from Western Equatorial State. So we have two different questions and comments. I would like you each to briefly respond to them. Yes, Poni, let me start with you. Yes.
Thank you. About how a woman is to get pregnant, a mother is to get pregnant anytime or at any time. If the child is 2 years or 3 years maximum, because we are here fighting for maternal mortality rate. Because when the mother conceives early within 6 months of breastfeeding, and then the child will not grow well. The child will grow with the complication. So maximum time we need to follow, and we are encouraging our communities, our families outside there to follow the maximum time for conceiving. If the mother is breastfeeding, is 2 years to 3 years maximum. Yes.
Right, and the issue of access to health facilities in the remote areas, mothers and unborn babies. I would like you to comment on that, Cosmos.
Okay.
And as a health worker, how do you normally deal with such situations, especially people who are in need in the remote areas but they are lacking health facilities?
This is actually my request, because when we talk of health, this is all our concern, whether be individuals or different kinds of communities. I want to say this, for our people who are in the remote areas, it's just a request, because I know sometimes awareness like this, if they have that access, where they can get awareness, maybe through the radio stations, they should have that time to listen to the messages that are actually, because sometimes I know in remote areas there's no access that maybe these services may actually reach to them, and this may be as a collective responsibility for all individuals on how do we get this access, that our brothers also from the remote areas get this access to health, because health is for everybody. In health, you don't segregate that this is so and so, this is from where, this is from where.
Right. Now we are running out of time. I will give you each a few seconds for your last message. What would you say as we wind up our conversation today, Pony, on the maternal and child health with focus on exclusive breastfeeding, poor child spacing, and hygiene in delivery? What's your message to the public, especially mothers out there?
Thank you once again. The message that we are giving to our people outside there about maternal and child health, we encourage good health facilities, that the services for maternal health child is well established. And for those ones in remote area, we are asking our government also to stabilize and this maximum facilities to be established in the remote areas, so that they will get a well maternal child health, because so that the mother and the baby will not end up going for complication like maternal and child death.
All right. Thank you for that, Cosmos.
My message is it's going to be especially our mothers. We know when you're healthy, you normally give healthy. You give healthy to your children. Your children will also be healthy. And I wanted to encourage that let us get these services from the hospital. And sometimes even at home, you have to maintain yourself better health, and you follow what is actually needed. When you get pregnant, that is the moment you're supposed to be healthy until the childbirth. And then the second message actually be on the child, poor child specimen. We normally know the mandatory is supposed to be 2 years and above. We are saying this because the moment when the mother gets pregnant, Yeah, you know, sometimes the body is there's going to produce a hormones to the body which changes the mother. And actually, this period at least need 2 years, such that the body will get it into normal, like the uterus. Because when you get conceived in the middle, when it is not yet time, and you may end up, the pregnancy will be having so many complications during pregnancy.
Right. Yes. Thank you very much. Jakudu Joyce Poni, registered nurse, and Chaplain Mila Cosmos, registered midwife. Thank you both for joining us on the Dawn today. Thank you.
Thank you.
Right, that brings us to the end of the Dawn edition for today. Join us again tomorrow morning at the same time to get the latest on what's happening in South Sudan and beyond the borders. Up next, news in Arabic on behalf of the Dawn team. I'm Emmanuel Joseph Akile. We meet again tomorrow.